Respiratory therapy, Lesson 2, Adverse effects of mechanical ventilation. This unit will cover the basics of respiratory therapy. The goal for this lesson is to understand the differences between spontaneous breathing and artificial respiration, and to learn about the adverse effects of mechanical ventilation. This is the content of this lesson. In a healthy person, breathing occurs naturally when the respiratory muscles, such as the diaphragm and intercostal muscles, cause thoracic expansion, increasing the negative pressure in the rib cage and causing the lungs to expand to inhale the outside air. This is called spontaneous breathing. On the contrary to spontaneous breathing, artificial respiration is breathing induced by applying positive pressure to the lungs and airways, and delivering inspiratory air to passively expand the lungs and thorax. In artificial respiration, the positive pressure is maintained in the airway and thorax. This phenomenon is a non-physiological condition for the human body, and thus artificial respiration itself is not physiological. There are several adverse effects when using the ventilator. First, as it relates to positive pressure ventilation and lung conditions, application of high pressure to achieve high volume of ventilation can lead to pneumothorax, subcutaneous emphysema, and ventilator-associated lung injury called VALI. Secondly, ventilator-associated pneumonia, VAP, is another adverse effect of the ventilator, which is caused by contamination of the circuit with bacteria introduced from the outside air while exchanging the artificial nose. The best way to reduce the risk of VAP is to wean the patient from the ventilator as early as possible. Thirdly, while on the ventilator, the patient is kept under constant sedation to avoid conflict with their own breathing. This can lead to oversedation and bedsores. Lastly, oversedation, high invasiveness, and being under constant management in intensive units can cause psychological stress that may lead to the symptoms of delirium. In all of the above four categories, the risk can be reduced by early weaning from the ventilator. This is the end of Lesson 2, the adverse effects of mechanical ventilation. Make sure you've mastered the basic concepts before you move on to the next level.